Hi, I'm Liz Marquis, and I'm here to help you support the older adults in your life. This is Aging Well Anyway, a podcast dedicated to empowering those navigating the journey of aging and celebrating the life that comes with aging well. Let's get started. Hi, everyone. Welcome to today's episode of Aging Well Anyway. Today, we're going to talk with Deb Bibbins, founder and CEO of For All Ages. And she's going to talk to us about the profound impact of social isolation on aging adults and detail for us the physical and psychological effects of loneliness. We're going to learn that social connection isn't just nice, but necessary for aging well. Thank you for listening. Hi, today on Aging Well Anyway, we're going to be talking about the very real impact that loneliness has on aging adults. Today, I'm joined by Deb Bibbins, founder and CEO of For All Ages, an organization dedicated to ending loneliness, reducing ageism, and promoting kindness across all generations. And they do this by implementing impactful programs that improve the mental, physical, and social health of people for all ages. Deb, welcome.
Thank you so much for having me today, Liz. It's a pleasure to be here with you.
I'm so glad you're here. Now, Deb, I have to mention that before you followed your passion of making the world a much better place for current and future generations, you had a very successful career in the insurance industry, which followed a very impressive education that included a law degree from the University of Connecticut, your MBA from the University of Massachusetts, and a Bachelor of Science in Finance from UConn. Now, I have to say, your education and early experience are very connected to the business world. So what led you to think about connecting generations with the goal of improving the lives of older adults?
Well, thanks for that question, Liz. Yeah, it's not something that I ever intended to do, but here we are. And it's actually something that I enjoy more than anything in my life. And I did have a great career in the insurance industry. I was very lucky to have a lot of mentors that taught me a lot of things about leadership and about giving back to others. And so community service has always been top of mind for me. And when I retired from the insurance industry about a decade ago, I started giving back to a number of local nonprofits and watched a family member go through a tough time at the end of his life. He was the last of his friends to be around. And one by one, his friends started passing away. And after, I'm going to say the last one passed away, he said, look, I'm the last one standing. And it was terrible to watch. And I was struggling with how to deal with it and how I could help. He certainly had family members around, but he had lost his buddies. And so I thought, gee, there must be something that I can do, some way that I can give back. And so after he passed in January of 2019, that's when I really dug into the research around loneliness and social isolation, but focused mostly on loneliness. And could there be any health impacts related to loneliness because he passed away quite suddenly? And so lo and behold, I found this huge body of research that people just haven't been talking about. And I went looking for a nonprofit to give back to that had some mission around connecting people, creating community, intergenerational connection, and couldn't find one. And so did some soul searching, reached out to a longtime friend of mine, Gary Sikorsky, and asked if he wanted to partner with me on this initiative. And here we are, 6 years later, and it's just been incredible.
Oh my gosh. That is amazing. I mean, it's amazing how one story can truly chart a path forward.
Yes.
But your focus has truly also been on, your founder and CEO of For All Ages, which makes us think intergenerational. So how do you find that loneliness has impacted the aging population? So what does loneliness actually look like?
Sure. Well, I think that it's important to understand that loneliness is different from social isolation, right? So loneliness is not the same thing as being alone. We often think about isolation, and that's easy to see, right? You can see that someone is alone in a room. Loneliness is a feeling, and people can be surrounded by others and still feel lonely. And it's really that feeling that the amount of positive social connection that we have in our life is not what we want it to be. And it's not what we desire it to be. And that disconnect actually has powerful physiological effects and impacts on our bodies. Research shows just at a high level that it activates our stress response. Increases inflammation in our body, which we know is not good, elevates cortisol levels in our body, and impairs our immune function. And so, it's just incredible to think about how the feeling of loneliness can affect not only mood and not only our energy, but it contributes to serious physical and cognitive health and outcomes and impacts. I do want to mention that back in 2023, our former U.S. Surgeon General, Dr. Vivek Murthy, understood this and recognized this and declared loneliness a public health crisis in the United States. He compared it to smoking 15 cigarettes a day. That data actually comes from Julianne Holt-Lundstad about a decade ago. She did some phenomenal research and continues to. And she was striving to find a way to describe the impact of loneliness in a way that people would understand. And we all know how bad smoking is. So she came up with this. It's basically like smoking a pack of cigarettes a day. And you wouldn't do that if you're trying to be healthy. And so you wouldn't want to feel lonely if you want to feel healthy. And so, the literature just goes on, and I think we're going to get into some of the impacts, but just starting with anxiety and depression and then going deeper into so many physiological impacts.
That's incredible. The 15 cigarettes a day, when I read that, it really hit home for me because you're right. No, we wouldn't do that if we wanted to feel healthy. So, of course, we don't want to do something that has that type of impact on our health. Now, loneliness and the impact, can we talk a little bit about the impact of loneliness and the detrimental effects it has specifically on older adults and the aging population?
Sure. I'd love to start with dementia, right? So for all of the research that goes into curing Alzheimer's, which is so vital and so important, it's interesting to learn that there are opportunities to prevent the onset of dementia. There's been research from as recent as October of last year, where a number of researchers looked at other research from more than 600,000 individuals across multiple National Institutes of Health funded studies. And interestingly, they were able to control for depression, they were able to control for social isolation and other modifiable risk factors for dementia. And they showed that loneliness is associated with a 31% increased risk of developing dementia. So that's just one study. There are other studies that show it could be upwards of 50% increased risk.
Oh my gosh, that is astounding because I think that possibly every listener listening now knows someone or is impacted in dementia in some way.
Yes.
So
it's astounding. It was astounding for me to read it, and I continue to read additional research that comes out, and it's coming out now on a more regular basis, which is wonderful because now we have a better way forward, right? We can be thoughtful about how can we make changes to our lives now to minimize the risk of dementia, not only for ourselves, but for our loved ones. I will tell you, and you've read my bio, I'm not a physician, I'm not a clinician, but the research that I've done shows that chronic loneliness, especially among older adults, is associated with structural and functional changes in the brain, particularly in the hippocampus and the prefrontal cortex. So for those non-clinicians, that's really where our memory is housed, right? They're key areas for memory and key areas for executive function. And so I'll also point out that chronic loneliness impairs our sleep quality, which we know is so important. And it just increases inflammation in our body. And both of those, impaired sleep quality, increased inflammation in our body, are linked to dementia progression.
Unbelievable. Well, let's turn this around a little bit. So the antidote to loneliness, and we're talking about social connection. What can social connection mean? I mean, how do you call it a modifiable risk factor, so that means we can change it. Is social connection the answer? And what does that look like?
Yeah. So thanks for that question. And so certainly social connection is vital. One of the things I did just want to point out, what I didn't mention earlier, I was focused on the brain, right, and brain health in my prior answer. But I did also want to add that loneliness impacts other chronic illnesses, right? So it increases the risk of stroke. It increases the risk of cardiovascular disease. And then we're now learning that it also increases a chance for type 2 diabetes, and significantly. And so I think when we are thinking about social connection and we're thinking about how it can have positive effects, it's all about how we feel when we are being around other people that give us this feeling that we are seen, right? And that we're supported, that we're heard and listened to and valued. And all of this buffers against stress. For each of us, whether we are older adults or whether we are teens, it's helpful. It improves our emotional regulation, and it actually enhances brain plasticity. So getting back to that connection with dementia, we know that social engagement is, as you mentioned, Liz, one of the few modifiable lifestyle factors that we can do to improve our opportunities of aging well and aging healthy. There are studies, I talked about studies on loneliness, but there are certainly studies on the power of social connection. Let's start with Harvard. So Harvard has an aging brain study that they have done for a number of years. And we also know that there is a study of aging coming from the UK, the English longitudinal study of aging, found that people that have rich and vibrant social networks and frequent positive interactions with others experience a slower memory loss, higher scores on executive functioning, and a lower risk of mild cognitive impairment. And so, it's interesting to say, I know I feel better when I'm around others that give me this sense of joy. But it's another thing to say, you've got Harvard and other really powerful organizations that's doing impactful work and impactful research saying, there's science to this. There's more to just that feeling of joy. We're talking real physiological impacts if you can be socially connected.
That's incredible. Now, when we think about in our real lives, do you have any stories maybe that you saw this in action, in practice?
So I do actually, and it was very interesting to me. I had the good fortune to meet with a woman at an assisted living facility here in Connecticut. And we're just going to call her Mary for the sake of anonymity.
Okay.
She was a former teacher, right? She was in her 80s, former teacher. She was living with some mild cognitive impairment. So she was, starting to experience memory loss, starting to struggle with finding her words. And she started participating in an intergenerational storytelling program. And so she was connecting with elementary and middle school students every 2 weeks. And she initially was a little unsure, wanted, about how to do this. She was feeling bad about herself because she knew that she was starting to forget words. But then she started sharing stories from her childhood. And it was after actually a few weeks, I'm going to say a couple of months, that the staff started observing that she was engaging more with the students, that she was feeling better, and her verbal fluency was improving. And so it started to reverse the effects, which, I don't know that there's any science that actually says it can do this, but the staff felt that her memory was increasing. And it was all about that feeling of being heard and being able to share and having that sense of purpose and feeling that she belonged where she was, right? So she was back in that familiar environment, right? That teaching environment that she had known for 40 years. And she was feeling comfortable and joyful. And it helped her brain functioning, which is incredible.
That is incredible. I mean, so this really goes to show that maybe there are things that we can actually do for the aging adults in our lives to help, because
Yes.
I don't know if I would think to do a storytelling activity, but I think that your story now reflects the positive impacts that just small structure and changes in our daily lives, the big difference it can make. So
Yes.
what would you recommend for us sort of as a society, as we're listening, to improve the social connection with our aging adults? What can we do in our everyday lives?
Sure. I think the first thing is to think about how whether you're talking about yourself or whether you're talking about a family member, right? Maybe an aging parent or an aging friend, find ways to give that person meaningful engagement, right? And prioritize it. So it's not just an afterthought of, okay, I'm going to go visit or I'm going to go have a conversation, but it needs to be front and center. Plan for it. Be intentional about finding opportunities for that person, your loved one, to feel useful, right? And to feel heard and to feel connected. And you'll know, right? You'll know it's an opportunity where maybe it's a hobby that they've enjoyed all their lives. And it needs to be something that's repetitive. That's what I would say. It also needs to be an opportunity for that person to have some type of mutuality in the relationship. So what I'm talking about is not just saying, okay, I found this perhaps intergenerational program where students come and they talk to older adults. It needs to be a conversation where people are giving back. And putting older adults in a mentorship role is so vibrant, right, of an opportunity to give someone that sense of purpose. Any type of mentorship, music programs. I mean, we know already the positive impact of music on brain health. And when you can take that music and also bring in positive social connection, it's like the icing on the cake. They're just especially effective. The other thing I would say is support that relationship building over time. So the one-off programs, they're great. They're a great start. Right? They give people this little sense of, oh, gee, I may have been missing out on this connection and I really enjoy it. But the real power lies in that sustained connection. So whether it's a buddy system or a phone call program, that the multi-week engagement really has a positive effect. We have a program called Tea at 3 for all ages that we run twice a year. It's 12 weeks. And we know that when people last and stay connected with we call them teammates, sort of a play on teammate, it's their buddy. When they stay connected for 12 weeks, they have so much more of an impact on their lives, right? The other person does on their life. So every once in a while, we have a group, or two people that maybe only connect for, say, 6 weeks, and they get something out of it. It's great. But when you can double that and stay connected for 3 months on a regular basis, you start to look forward to those phone calls. I'll say that program lasts for 12 weeks. We often see our teammates staying connected long after those 12 weeks.
That is a true testament to the strength of those bonds.
Yes. And that's what you want, right? That's what you're going for when you're thinking about a loved one. I think the last thing that I would mention is for professionals that are in this space, right? Helping adults age well and age in a healthy manner. They need to learn to, I'm going to say, recognize loneliness. So loneliness cannot be clinically diagnosed. It has to be admitted to. Someone needs to say, I'm feeling a bit lonely today. But there's ways for professionals to tease that out in a kind way for adults that they are caring for. And you can also see it, right? You can see when someone's feeling a little sad. When family members may not be coming to visit. I've experienced a number of assisted living facilities where, you see a person who doesn't have anyone coming to visit them. Those are the people that you need to give some extra TLC to and think about how to connect to them on a regular basis, maybe with some new programming.
I mean, you bring up a very good point. Professionals in the industry. Right. So senior living professionals, but also medical professionals. I mean, I know that as people age, maybe they visit their doctors more often.
Right.
Maybe they see physical therapists more often. So are those professionals, should they be brought into this conversation? And how do we work that in when the medical professionals are so focused on medical health? Sometimes it's hard in the few minutes that they've got available for their patient, their aging patient. How would we even talk to them about that? What should they be thinking about, I guess?
Well, that's interesting because it's one of the things that we're working on with the Connecticut Collaborative to End Loneliness. And in the conversations that we've had with clinicians, right? So those geriatricians and others who see older adults. And I'm going to say because social connection is powerful for people of all ages, anyone who's seeing a physician for an annual physical exam, there needs to be some conversation built in somehow, some way around how are they feeling about their social connectivity? And, when was the last time they talked to someone on the phone? Those types of simple questions, are you getting exercise with a group? Right. Like teasing out those opportunities. Maybe they're a member of a club or maybe they're feeling terrible. And there needs to be a conversation around being intentional of reaching out and reconnecting with others that are in their lives. Maybe starting to take a yoga class or go to a library program. It's really difficult, though. Clinicians don't have a lot of time. It's troubling from my perspective because of the way that the current culture is with having to spend a little amount of time. You have to bill to get the coverage from insurance. I believe, though, I'm optimistic, and I believe that as insurers start to learn more about the power of social connection to preventing chronic disease, that they will enable clinicians to spend more time with their patients talking about their social interactions and their social engagement. Not an easy answer, though, Liz. It's something that we're striving for. I would also mention that social connection is not taught in medical schools, right? And so for all of the clinicians, whether you be a nurse practitioner or a physician assistant or a physician, they haven't really thought about it. It hasn't been part of the curriculum. And that's one of the things that we're thinking about. How do we get medical students and nursing students and PA students thinking about this so that they naturally bring it into their practice?
Yeah, it sounds like it would just benefit everyone all around. If the health benefits, the studies are showing that social connection can help with true health benefits, then it just seems like it seems like an obvious thing to do, but we all know that sometimes those things take time. So you brought up your work with the Connecticut Collaborative to End Loneliness. Is there anything that we can do to learn more? Like, what is your participation, I guess, on the state level there?
Yes. So For All Ages is the convener of the Connecticut Collaborative to End Loneliness. We actually started convening it 2 weeks after our former U.S. Surgeon General declared loneliness a public health crisis. We knew that we needed to act. We knew that the time was of the essence, right? So we're hearing about this taking place not only across the United States, but this has been a problem, a growing epidemic across our world. And I'll just mention that the World Health Organization has just passed a historic resolution 2 weeks ago, actually. So I'm going to say in May of 2025, I'm urging member states to focus on social connection for their residents. But here in the state, we are focused on spreading awareness of the positive impacts of social connection. We're trying to reduce the stigma associated with loneliness because that stigma exists and it should not, right? It's a human condition. We're social beings. We're meant to be together. And we're focused on also working with clinicians to think about how we can engage in a positive way in the future around patients. So we know that they are the place where most people have, once a year at least, a connection, right, via an annual physical exam. Anyone who's interested in learning more can go to our collaborative's website, which is endlonelinessct.org. or anything about For All Ages, our programming, any of our work, that is forallages.org.
It's amazing. Deb, this conversation has been eye-opening to me for sure. Just the impact of loneliness, the steps we could take to facilitate social connectivity, the health benefits, the brain benefits, not to mention just the overall feeling of good well-being. So I want to thank you for joining us today to talk about the importance of social connection for aging adults. For our listeners, we would like to underscore the importance of connection for you and to recognize that social connection for the aging adults in your life is just not something nice to have or nice to do, but it truly is becoming necessary for aging well. And just to wrap up our conversation, I just wanted to highlight the 3 points that I'm taking away. And Deb, please feel free to jump in if I'm missing anything. But my takeaways, loneliness is a true biological consequence. It has true consequences and that can accelerate neurodegeneration, just degenerative health impacts. Social connection is a powerful tool to improve not only brain function and foster overall well-being, but also to slow the progression of cognitive decline. We talked about slowing, and those percentages reflected in those studies of being able to slow the progression of dementia is truly, hits home to me. And that loneliness is something we can change. We call it a modifiable risk factor, which means we can change the risk that loneliness could potentially have. And one thing I think that we may want to mention, and you touched upon it earlier, is that people who are more socially connected, they feel more empowered maybe to take control of their own health. Maybe they eat better, they exercise. You talked about group exercise. And so it's a little bit of peer pressure in a good way. When you're socially connected, you're more apt to make good health decisions.
I think all of what you said is spot on, Liz. We know that we're meant to be around others, right? And we all know how we feel when we are having a good time with people that make us feel like we belong, right? And so we need to be thoughtful about it. We need to be intentional. We actually created a word last year. I'm just going to share it. Maybe it'll stick in people's mind. But the word is connectful. Right? So we ask people to be connectful and thinking about connection and thinking about how joyful and wonderful you feel. So I would leave everyone with be connectful and help your family and friends also be connectful.
I love it. I love it. We're all going to go out and be connectful. I think that's a great spot to end on. And just for all of our listeners, you can find more information on forallages.org. So, Deb, thank you for joining us.
Thanks so much for having me on, Liz. It's been fun. And I'm really looking forward to the time, maybe a decade from now, where we start to see a reduction in all of these chronic illnesses. I mean, that's what we're striving for. And I'm hopeful.
We're all going to be committed to being connectful. Deb, thanks to you.
Thank you.
Now for the legal language. The opinions and information shared in this podcast are for general education and informational purposes only and should not be taken as professional legal, medical, or financial advice, nor should it be a substitute for legal, medical, or financial advice from a professional. We are not lawyers, doctors, or financial advisors, and you should consult with a qualified professional for specific advice related to your situation. All content, including audio, images, and text, is the property of Aging Well Anyway and is protected by copyright. Reproduction or distribution without our express written consent is prohibited.
If you enjoyed today's episode, please feel free to leave a comment, like, or share with a friend.